Good afternoon. So of the 423 cases today, that gives us now 4,035 active cases of coronavirus here in the state of Victoria. As the Premier said, there are 173 Victorians currently in hospital with COVID, of whom 44 are in intensive care and 23 of those are on a ventilator. And we, of course, send our very best wishes to all of them as they recover from COVID over the days and weeks ahead. With the distribution of the outbreak is very similar to what we've seen over really the last couple of weeks. So in the northern region, we have 274 positive cases in our northern suburbs. That includes locations such as Craigieburn, Roxburgh Park and Glenroy. In our western suburbs, we have 112 cases, so just over a quarter. In suburbs such as Truganina and Tarneit and Point Cook. There are 10 cases in our eastern suburbs across Croydon and Donvale. And there are 25 cases in the southeast of our city in Keysborough, Dandenong and Clyde North. There are 5 regional cases. Brett has mentioned 2 of them, obviously in Ballarat. The other 3, we have a case in Geelong, which is a primary close contact, a household primary close contact of another case, well locked down and isolating. And we have 2 cases, again, primary close contacts, household contacts in Mitchell Shire, again, both isolating at this time. And that gives us our 423 cases. If I look at all of our active cases across the state at this point in time, 88% are in our northern and western suburbs in those really well-defined postcodes of priority that we're focusing on. And again, my thanks to all the teams supporting the community in those postcodes. It's a huge effort across local councils, civic and community leaders, and of course our public health teams working to support people in those areas, those who are still living with COVID and doing those hard isolation protocols as we go through. We still have 61 active cases in total in regional Victoria. Some of those, of course, we've mentioned in Geelong, and in Ballarat, but the vast majority continue to be in Shepparton. They are, of course, under very tight isolation protocols. And it's all around our confidence around the controls in place that allows us to now move towards easing off Shepparton, but also we're now very keen to understand what else is happening in the Ballarat area. I'll call to 4 particular outbreaks of concern. The Box Hill construction site, we've had a further 10 cases. That's now up to a total of 146 for that outbreak. We are now doing day 13 testing, so those 10 cases came out of day 13 testing, and that work continues on. At the Fitzroy Community School, we have a further 5 cases. We're now up to 38 cases in total for that school. I am pleased to report that there are 76 primary close contacts. 8 out of 10 of those have now returned a negative test result, so hopefully we're starting to see the bottom of the barrel in terms of the number of cases we expect to see with that particular outbreak. The school, of course, continues to be closed as we work through the isolation protocols with the remaining positive cases and primary close contacts. The outbreak across the V-Line organisation, we now have 6 staff in total who are positive cases. So we've had 2 more positive cases in household contacts over the last 24 hours. 199 other staff members are primary close contacts. And of course, my thanks to the V-Line organisation for the work they're doing to bring back train services and coach services whilst those 199 staff go through their testing and isolation process. And finally, we have 7 positive cases associated with the Oporto restaurant at Coolaroo. That includes one of the cases in Mitchell Shire who's associated with that particular site. In terms of wastewater, of course, as Brett has spoken to, wastewater testing has been really important in terms of identifying our concerns around the Ballarat area, with the wastewater triggering now in 3 different catchments in and around the city of Ballarat wider area. We've also had a positive wastewater detect for Aries Inlet and Fairhaven since the middle of last week. So if you're in the Fairhaven and Aries Inlet area, if you are symptomatic, then please make sure you use this prompt to come forward and get tested. Barwon Health will be setting up some additional testing facilities in the area to make sure you can do so easily. In terms of testing, another big day, 54,000, almost 54,500 tests today. That brings us to, during the course of today, we will hit the 2 million test mark for this particular outbreak. We've seen really strong and consistent testing demand, particularly across the northern and western suburbs, but also in other outbreak locations such as Shepparton. And I'm sure we'll see a very busy day in testing in Ballarat and again over the next few days. My thanks to everybody who's coming forward so promptly to come and get tested. That, of course, allows us to build that really clear picture of where the outbreak is the most active, allows us to get support to you if you're testing positive and your household and family members. We continue to see good demand across our network, but also waiting times are all listed on our website. And again, I ask you to please check your nearest testing station before you set off. We are moving some of our testing sites around. There's an additional testing site set up today in Craigieburn at the Splash Aqua Park. That'll be available. We'll continue to run that for the forthcoming days. And the testing stations in Tarneit and Hoppers Crossings will be extended, will run extended operating hours until 8 p.m. today. Finally, with regard to Ballarat, the regional response team has now been activated to support the Ballarat outbreak. We went through a very similar process, of course, with our outbreak in Shepparton, and we have regional response teams active also across our metropolitan area dealing with those significant outbreaks. That team is meeting later on this afternoon. It includes, of course, critical partners such as the local council and local health services, but also all the relevant arms of government, including, of course, led by our public health teams, but also across VicPol and Department of Family and Housing Support and other services. The job of that regional response team is to provide full support to the wider community around Ballarat, making sure we can support you as we go through a really big testing drive and vaccination drive over the days and weeks ahead. And we'll work and ensure good and effective local communications and coordination of a wider support effort. We are working through setting up additional testing capacity across the city of Ballarat at this point in time, and we will be running extended operating hours for some of our testing sites. I'd encourage at this time, anybody in Ballarat who is symptomatic, please come forward and get tested. And if you've been to those exposure sites that are listed on our website and that Brett's talked to, please again come forward to get tested. We will, of course, encourage other people over the coming days to get tested in Ballarat, but for now we'd really like to focus on those who are symptomatic and who have been to those exposure sites. I am expecting a busy day in Ballarat from a testing point of view. We will be with you over the days and weeks ahead, so please don't rush forward to get tested if you don't have those symptoms at this point in time. Finally, in terms of vaccination, 69% of the population of Ballarat, of adult population 16 and over, have had their first dose vaccination so far. There are 1,500 first dose vaccine appointments available in and around the Ballarat area at this point in time. So I would encourage, if you haven't yet had your first dose vaccination anywhere in Victoria, please book it. But particularly if you're in Ballarat, please use this as an encouragement to come forward and get that first dose vaccination done. We are sending thousands of additional doses of vaccine to Ballarat over the coming days, and we'll make more announcements over the next 24, 48 hours in terms of where those doses will be allocated, so that people can come forward and use this as a quick surge to boost the vaccination rate in Ballarat and to get through this outbreak. With that, I'll hand back to the Premier for questions.